Hello everyone, good evening. This is a fresh episode on the role of justice as a guiding principle in patient care. This pertains to AETCOM modules 2.2 and 2.3. As we all know, the justice is an important pillar of the ethics principles, and justice is described by Aristotle as giving each that which is his due. Justice is important because it determines equitable, impartial, and fair distribution of resources and healthcare services to the sick. It is a core value in delivery of the health services, and within it encompasses compassion. The principle of justice, being an important one, is enshrined in the World Medical Association Declaration of Geneva, International Code of Medical Ethics, and several medical oaths, including that given by NMC. The WMA Declaration of Geneva says, I will not permit consideration of age, disease or disability, creed, ethnic origin, gender, nationality, political affiliation, race, sexual orientation, social standing or any other factor to intervene between my duty and my patient. Therefore, there is no role of prejudice while treating a sick. This ensures that patient has equal access to the quality care as per the current standards. And what are the types of the justice? Social justice is very commonly used term that applies use equitable rights to access and participation in all aspects of goods and services in the society. Whereas in healthcare, we talk of distributive justice that applies to healthcare services and envisages right to be treated equally regardless of social, economic or political status. Everybody should be treated in the same manner depending on the disease and the need of the sick to provide fair and equitable treatment. Equitable distribution of health resources and services is the cornerstone of distributive. There is a term called as prioritization. There are many occasions where healthcare services and goods are prioritized according to the differential needs. And to understand this, we must understand difference between equal and equitable. Whereas equal describes similar in proportion or quantity to individual, and equitable means to each according to the need. So it is very important that if there is a seriously ill patient, he should be attended first, despite a number of other patients waiting. And this is as per the egalitarian theory of resource allocation. So, based on healthcare needs, emphasis on treatment of critical patient to save life, and even provision of costly medicines and devices according to the need of the sick, without any other consideration. However, prioritization should not be based on discrimination, which can be social, individual, political status of the patient. A patient with treatable cancer versus upper airway infection, we must understand who should have a priority treatment. Guiding role of justice. It has immense role in patient care, health development of healthcare policies, rationing of limited resources, and is very important in clinical research. The philosophy of use of justice in biomedical research is risk of the harm should be allocated fairly. Here fair means no one particular group, depending on the factors, receives disproportionate benefits or disproportionate harms. That is very, very important. And this requires appropriate representation of the patient, that is the selection, criteria of inclusion, criteria of exclusion. There is some conflict of interest that may lead to injustice during drug trials. For example, you are receiving enormous amount of money. Now, however, this conflict of interest arises due to dual role of a prescriber as clinician and researcher, and this may cause some problem. That is, treatment should be done, violation of the protocol should be done, or code should be decoded. There are so many factors that will determine. So there is a direct and indirect financial gains and personal promotion that may affect the injustice during clinical trial. Selection bias, exploitative participation, and non-disclosure of serious ADRs are just examples of injustice. Practice of justice promotes ethical behavior. This is very important. That promotes beneficence and non-maleficence. And it also promotes patient's trust and patient's engagement in the treatment plan. So it enhances autonomy of the patient. Now, during practice of medicine, clinical practice, non-discrimination in providing healthcare and healthcare related information, ignoring social inequalities. Equitable distribution of available resources, I have already discussed. During medical education, giving equal opportunity to all students to develop their competencies and equal opportunity for evaluation of their competence during examination. Some examples of injustice, there are a lot of the subtle examples which come across during our daily clinical practice. Only some are there. They are actually my personal views, and there may be many more than this, and some of them may be hypothetical. Delaying frozen section report of a carcinoma patient and who is under operation table, and the microbiologist may prefer to report CVC of a VIP. Not examining stool slides diligently and giving a negative report. Hurried completion of microbiological report so that more time is available to work in a private lab. Not giving adequate time for training and teaching of UGs and PGs, therefore inadequate competencies developed. And there is always some bias during evaluation of a student depending on the gender and social influences. So these are the examples that inculcate injustice during clinical practice and also during paraclinical development. And this should be, as far as possible, should be factors that affect the practice of justice is ethical dilemmas, the ethical principle of beneficence, non-maleficence, autonomy and justice often conflict in real-time clinical situation, and doctor has to exert a lot according to his wisdom and need of the patient to see and ensure that the principle of beneficence is important and it should be done in the interest of patient. Guidelines and policies should be made, and that will reduce the such ethical dilemmas. Social economic disparities are many, particularly in our country. Urban-rural divide, rich versus poor, economic status, and access to primary, secondary, tertiary health care facility and availability of services. You may note that in doctors don't need to go to rural areas, whereas lot of the experts are available in cities. So that type of disparity may not provide justice to rural patient. Political influences do affect the practice of justice. That is important. To summarize, the key components of justice are equitable access, fair treatment, transparency, socio-culturally competent care, and distribution of resources and services according to the need, that is equitable distribution. And therefore, every individual must be given what is morally right and due to him. Health care is a right of the sick. Every patient should have equal access to standard of the care. Doctors should be guided by the principles of justice, provide treatment fairly and non-discriminatory to all sick, and social inequalities should not make doctor prejudice to a particular group. He should be guided by principle of justice even when under pressure by different groups, and by practicing justice. Compassion and empathy promotes practice of justice. Thank you very much for watching. You can also visit another episode which was earlier discussed and aired over YouTube, Learning Pharmacology, Spotters and Booters, number 17, that addresses to somewhat AETCOM 2.2. Thank you and good.